So hello everyone. Good morning, good evening, good afternoon, wherever you're joining us from. Welcome to our session today. My name is Sarah Saket. I'm the Advocacy Officer at the Royal Health Awareness Society here in Amman, Jordan, and I'd like to welcome you all to our session. Today, we're gonna really have a sort of open discussion on the thematic areas related to health equity. And I'm gonna be your moderator. And this session is basically designed to inspire global health professionals such as yourselves, embrace and implement health equity approaches in the work that you do. So as we all know, health equity is a core component of sustainable development and humanitarian action. And it ensures that basically everyone has the opportunity to achieve their best health by addressing many barriers that we have, such as poverty, discrimination, and unequal access to healthcare. And as we all know, unfortunately, in the humanitarian context, these challenges are definitely exacerbated and amplified. So in order to sort of advance health equity, we really need to take key actions to really help promote it through our initiatives and through our programs. And these can range from assessing the needs of the community that we're working with, engaging the community that we're trying to target or trying to benefit, strengthening health system, as well as collaborate across different sectors and not just primarily focus on the health sector, but kind of integrate education and employment to tackle the root cause rather than just tackling outcomes as they come. Also, other key actions can include advocacy for inclusive policies that will support the initiatives that we're trying to implement that are backed by sustained funding. So basically, our session today is going to explore these different strategies in a real-world setting, on-the-ground solutions, on-the-ground experiences, as well as the global perspective as well. So I'm just going to give you a few basically instructions and tell you how the flow of the session is going to go. We're going to begin with presentations from our panelists, followed by a very brief testimonial video showcasing real-world impact and on-the-ground work from the experience that we've had here in Jordan. After that, we'll open the floor for a Q&A session where we'll be able to hear from you and possibly explore the scalability of the strategies that we've been discussing in basically different contexts. So firstly, I'd like to encourage everyone to introduce yourselves in the chats if you haven't already. Please share your name, your country, your organization, and the work that you do, because this session is an amazing opportunity for us to learn from each other and basically share our insights on this matter. So without further ado, let's dive into our session. Our first speaker is Ms. Hamida Jahama, who's a dedicated leader in the humanitarian response and development sector with over 12 years of experience in program and quality management. As the country director for Plan International Jordan, Hamida drives impactful programming for children's rights and gender equality. Hamida will be providing very valuable, I believe, a perspective on how global and donor organizations can strategically promote health equity, particularly in low resource settings and humanitarian contexts. So please, Hamida, the floor is yours.
Thank you so much, Sarah, for the introduction, and thank you for the kind invitation for this very important symposium, I believe. And it's very timely to talk about that, particularly with professionals in this field. So as mentioned in this session, we're going to talk a bit more about how we can be supporting health systems or developing health systems that responds to the complex realities of people's lives in Jordan, in the region, but also globally, as we're seeing the changing context and the changing realities on the ground. Starting with the very first maybe a point that Sarah has been mentioning about the global donor focus on health equity. Through various engagement with donors, various types of donors, multilateral, private, we have been noticing that there is a focus on prioritizing vulnerable populations. And with that, I'm really looking at the intersectionality lens that many of the organizations, of agencies that work directly with the communities apply. And with that intersectionality lens, if it's properly applied, looking at the gender, the age, even like the refugee status, it all influence how we prioritize those vulnerable populations. So we identify the disparities, we look at disaggregated data, and then we can move toward having inclusive policies and holistic approaches that really addresses the needs of those populations on the ground. When we look also at the addressing social determinants of health, I'm going to talk about it in length in the second slide, so I'm going to stop here. And the social aspects also play a crucial role that we are all aware of and that we are all facing, whether we're working in advocacy with the donors and also with the government, but also with the communities on the ground. The third point, I think, is quite crucial and needs a lot of attention from our end, which is how donors approach or see the collaboration and partnerships that we form. And here we're looking at the multi-sectoral partnerships in particular. With the limited funding that we all are aware of, donors are more and more looking for alliances at consortiums that really bring added value and complementarities to each other's roles and responsibilities. So the collaboration and genuine partnerships with the government, with the relative NGOs, but also with the private sector, particularly to tackle the health equity issues, is really critical. Those collaborative efforts is not only essential to be granted with a fund or to start a project, but it's also essential to achieve the sustainability and to yield greater impact moving forward. The fourth point, really, again, how donors look at it with an AI era that we're all living at. The data and innovation is also really essential to navigate early on as we look at the health equity and the health systems overall. So any investment in developing databases and systems to monitor those health disparities, to improve the transparency and accountability, to be able to invest more in utilizing the data developed or collected to drive evidence-based strategies, it all really yields positive results as we look at greater and better health outcomes to the interventions that we do on the ground. And this is how donors also foresee that. If we move to the second slide, please. Like you can see now, only the bullet points of the main challenges and opportunities that we face, particularly in ensuring active and meaningful community engagement when it comes to looking at low resource settings and refugee population in particular. Identifying the challenges and opportunities is crucial for different reasons because it will enable us to better plan, to better communicate with the donors, with the professionals on the ground, and to better tackle those with proven and adopted best practices that might be adopted by other organizations or has been identified as opportunities throughout the engagement with the people. So the challenges that are and has been identified, particularly through the community engagement and in looking at program sustainability with refugees, in particular, starting with the instability. And with that, we know that refugees, in particular, they do frequent relocations. There is inconsistent access to service, which also leads to making their sustained engagement difficult. This is also another main challenge we've been looking at is the cultural barrier. And with that, we're looking at various cultural norms. We're looking at diverse backgrounds that communities can come from different backgrounds, which can really complicate the efforts to design and deliver programs that is universally acceptable, but also needs to be, most importantly, culturally acceptable and relevant. And that leads into another challenge is, the time and effort that needs to be invested to reach the trust and the relationship building. When we look at health-related intervention, it's essential to achieve that consistent, transparent engagement with the communities in particular, whether it was with adolescent girls, with young men and women, with parents and caregivers. And it could be challenging, particularly if there are resource constraints in place, which links to my following point about the funding instability and the limited local resources that could be invested in that. So the inconsistent funding could lead to fragmented support, hampering the development of programs that could address longer-term needs when it comes to health. But it's because it's not a one-time response or a one-time project. It really needs that investment in a longer-term interventions and plans and engagement with the relevant actors. Linked also with the safety and security concerns, with political, social unrests, all of that can really make it hard for community members to actively and meaningfully engage in initiatives or to participate freely and openly in whether it was the planning, design, or also the implementation of any program. The opportunities are many, as you see, so the challenges are a lot, but we also believe that the opportunities are even more, and they are broader. I'll start with the maybe golden opportunity that we always look at, which is the community empowerment and ownership. Nothing can be adopted, utilized, and proven to be successful if there is, I won't say 100% ownership, but really a high level, a high percentage of ownership by the community members. And with that, we really support individuals, whether they were youth or youth groups or local organizations, to take on leadership roles in their communities. That would really support us in making programs more resilient to the changing context and the changing factors that would arise. It would also build accountabilities in place and increases the likelihood of sustained impact. And Plan International adopts a localization approach, and there has been like a misconception that localization is only linked to working with local partners, but it's greater than that. It's giving the ownership to the community members, to the local organizations, to help in the budgeting, in the design, in the planning and monitoring, and holding us accountable toward what we do. And that is really crucial, particularly in health-related interventions and programs, because of its sensitivity and potential, relevant, because of its sensitivity in particular. The second opportunity is really about building the capacities and skills, and I'll go through them quickly for the sake of time. So it's equipping the community with the skills and giving them this leadership role to be able to practice what they've learned and what they have incurred from experience and knowledge. And that's, again, linked a lot with the community resilience aspect. Creating economic opportunities is linked with the community engagement, because if they are trained on skills, they own the process, and then they're also getting an income generating, resource out of that, that will give them a sense of meaning, a sense of purpose of why they're doing that and why they're leading this mission alongside, like-minded people. So really training the community members for a broader kind of vision of having them utilized as professionals, as workers, as trainers in the field with proper economic empowerment lens in mind, would ensure active and sustained engagement of them moving forward. The partnerships has been mentioned and the innovation has been mentioned. And with that, I have to emphasize that utilizing the powerful tools of communication, of education and data collection is particularly essential to disseminate messaging around health, but also implement programs with quality. With maybe the following slide, looking at the social determinants of health. And with that, I'm going to refer very quickly to a program that we're implementing with our partners RAS, NRC, Jordan Chamber of Industry, and other partners, where we implement an integrated program that looks at empowerment of youth. We're looking at the education, at the health and the enabling protective environment for adolescents and youth, and we're also looking at the economic empowerment. So that integrated programming had a magical, I would say, effect on the success of the interventions. Now we're in the third year, and we can see how talking about sexual and reproductive health and rights, talking about comprehensive sexuality education with an umbrella of an integrated program on youth empowerment have a different, stronger, I would say, impact in advocacy, in policy, in looking at also the broader, longer term impact of that program moving forward. And one of the best practices was looking at the community-led design. I've mentioned how the localization, how the community ownership and engagement, but it's also, again, being deliberate in engaging them from the very first phase early on in really understanding their priorities. How do they see it from their end, and then approaching the donors and doing the design. That is quite crucial to better tackle the unique determinants of health within each and every community. Even in one country, each and every community could have very specific attributes that needs to be looked at. That links with the strengthened policy and advocacy efforts, I would say, because when we look at how we can invest in policy reform, that all cannot be done, cannot be achieved if it's not really linked with creating this longer term impact on health equality, and with funding initiatives that really builds on that community engagement and have structured advocacy elements on the ground. The last point here is looking at the gender responsiveness and inclusive services. Najah Huna program has been adopting a gender transformative approach throughout. And with that, to achieve the youth empowerment, to achieve that enabling, protective, and healthy environment for youth, we've been looking at addressing the gender inequalities in the communities through, I would say it could be looked at theoretical terms, but it has been applied on the ground with the partners. So it was looking at the unequal power relations in the communities. We were looking at empowering girls and young women, engaging men and boys. That all led to a systematic change that we are already witnessing in the program. So the gender responsive element was quite crucial. I'm going to end very quickly with a very positive note, maybe on best practices that focuses on the strategic partnerships. Adopting the holistic approach, partners were seen as a vital player all the way long. They have enabled us to look at the comprehensive perspective, looking at the different pillars of the program that I've just mentioned, Najah Huna. Working alongside the local organizations helped empower communities to take charge of their own health initiatives. This included, involving the youth committees, the community health committees, as I said, in the planning and implementation, and collaborating with local partners allowed us to learn better how to adapt our program as we move forward, and also to exchange successes and challenges to help refine the strategies of the program as we move forward. I'm gonna maybe end on that note and just say that strategic partnerships are quite vital for dismantling this systematic barriers and to ensure that health equity becomes a reality for all populations. I'm gonna hand over back to you, Sarah. Thank you.
Thank you so much, Hamida. I mean, everything you've said is really giving us a really important and much needed perspective of the global framework that we need to keep in mind when we're trying to implement on the ground efforts and initiatives. And I completely agree with you when we're talking about community-based approaches and always integrating the community when we're trying to implement any projects to advance health equity, to always have a multi-sectorial approach, as we mentioned, to not just focus on health on its own, but kind of integrate education, maybe economic empowerment and employment to ensure the ownership of the people that we're trying to benefit, and to ensure that the projects are sustainable and they're giving them the power to make the choices, to change, as we said, the root causes rather than just changing the outcomes. So building on that, I would like to go ahead and go to Mahmoud to introduce Mahmoud. Mr. Mahmoud Nabilsi is the Director General and the Director of Programs at RAS. Mahmoud brings 17 years of experience in youth development, entrepreneurship, and humanitarian projects across multiple countries within the region. Mahmoud is going to kind of give us the approach and the perspective of the on-the-ground experience of how RAS uses some of these strategies to implement its programs and promote health equity. So Mahmoud, the floor is yours.
Thank you so much, Sarah, for the introduction. Just a quick correction, I'm the Deputy Director General for us, yes. And I'd like to start where actually Hamida ended, basically. And I like the link between the leadership roles that young people play and the link with the resilience communities. So basically, this is a core or a stepping stone for us as RAS in our programming. So in my presentation, I'd like to take the opportunity to present RAS and its mission basically, and then I'll jump into our models in programmatic level. Then I'll be presenting two programs that we work with, which is Shabab and Najahna, building on Hamida's input. Lastly, I'd like to present some key recommendations for young people as key and instrument for us. So RAS is a national organization that's based in Jordan, Amman. RAS was founded in 2005 as an initiative by Her Majesty Queen Rania. Our vision is to promote health awareness and empower Jordanians to lead and community members to lead healthier lives. RAS focuses on preventative health, which means that we aim to address and reduce health risks before they escalate. By aligning with Jordan's national health priorities, we direct our efforts towards building resilient health communities through programs that target youth, schools, and communities. We aim to impact lives of an early age and encourage healthier behaviors throughout their life. Our vision is fundamentally about sustainable health for all, and we believe, and for all here, not only for Jordanians, for everyone who lives in Jordan. We believe that everyone should have the opportunity to lead a healthy life, regardless of their socioeconomic status or location. Our mission is deeply rooted in the idea of equitable health access, where each individual, from young children to adults, has the right resources and knowledge to make informed decisions. And to achieve this mission for us, we crafted initiatives that are around two foundational models: the life cycle approach and the socio-ecological model. So yes, exactly. And in this slide, we will tell you more about how RAS adopts the life cycle approach through our programs. So basically, RAS operates with a life cycle approach, which means that we design programs to support individuals at various stages of life, from childhood through adulthood. So the life cycle approach is an essential in addressing the unique health needs that arise at each age of and developmental stages. For example, we have programs in schools to teach children about healthy eating and physical activity, laying the groundwork for long-term health behaviors as youth transition into adulthood. They face new challenges such as stress management, nutrition, and sexual reproductive health and rights. By adopting this approach, RAS ensures that health education is relevant, age-appropriate, and continuous. This way, we're not only addressing current health needs, but are also preparing individuals for challenges they may encounter in their future. Health education and awareness then become a constant, lifelong journey rather than an isolated intervention. The second model that I'm going to present, which is on the screen here, the socio-ecological model that Ras adopts. So while life cycle approach addresses health over time, our socio-ecological model targets health influences across different levels: society, individual, interpersonal, organization, and community as a whole, above the policy level. So Rice recognizes that to create real change, we need to address health issues not only at the individual level, but also within their families, their surrounding communities, and the broader societal context. So at the individual level, for instance, we focus on healthy behaviors and make personal lifestyle changes. At the interpersonal level, they may influence friends and families by sharing what they've learned. At the community partnerships, like also RAS has with local organizations, we create a supportive environment for these health behaviors. And at the policy level, we advocate for systems that reinforce and sustain healthier choices. So this multi-layered approach ensures that health messages resonate across various levels of society, building a culture of health that's both wide-reaching and deeply rooted. One of our examples that I'd like to focus today, which is the core of our presentation, which is mobilizing youth through Shababna. So we have a project that's called Shababna, which was launched in 2011. Shababna is a youth-led program with ambitious to mobilize young people as health advocates and empower them to lead health education efforts across Jordan. Through Shababna, RAS has trained over 10,000 youth volunteers who have launched more than 100 health initiatives impacting around 35,000 people in their community. Our youth volunteers are equipped with essential skills through extensive training that covers national health priorities, leadership, communication, and advocacy. Shabab has partnerships with organizations like Ministry of Youth, the Arab Youth Climate Movement, Nashmi Initiative, and the International Federation for Medical Students Association in Jordan. These partnerships allow us to collaborate on a larger scale, reaching even the most underserved areas. The network of these partnerships has extended to our reach, enabling youth to promote awareness on pressing issues such as SRHR and non-communicable disease, NCDs, and basic hygiene practices. For Shababna, it focuses on how youth can be powerful change makers when they are basically empowered with the right resources. Volunteers who are part of Shababna network take what they've learned back in their communities, educating others, and especially the peer-to-peer approach, promoting health literacy, and leading example as young people. So this is basically for Shababna. We have one important aspect for Shababna, which has been recently introduced, which is called Shababna app. So it's an application that was launched few months ago in August, I believe, 2024. So this app is a digital tool that's designed to enhance and sustain youth engagement. Currently, the app connects over 1,500 youth volunteers across all governorates of Jordan, allowing young people to access health information, training, internships, and even track their community service hours as part of the application. Though Shababna app is more than just technological tool, it's a digital hub that fosters connectivity, support, and sense of belonging for young people. It also provides youth with the health messages that they can share within their communities, reinforcing their roles as health advocates. The use of this technology also expands our reach and making it possible to connect with young people wherever they are, and encouraging them to take ownership of their health journeys. This is for Shababna and the Shababna app. I believe the last slide, which focuses on Najahna, and Hamida has thankfully introduced Najahna, and I'll just play a role like how Najahna has a meaningful role in community empowerment. So Najahna for us, it broadens RAS community impact by empowering Syrian refugee, particularly women and girls, with health and economic support. Najahna works to address health equity from an economic angle, recognizing that poverty and economic insecurities are barriers to health access and overall their well-being. By integrating economic empowerment with the health education, Najahna builds resilience among women who are key drivers of family health decisions. These women who are basically living in certain governments of Jordan are empowered by training and resources where they strengthen their families' financial stability and pass on knowledge about health-related topics that are fundamental aspects of health equity that impact their children and communities. Najahna exemplifies the RAS commitment to empowering vulnerable groups and addressing health at intersection of social and economic factors. Basically, for us, through these initiatives, what we're doing as RAS, we're trying to build a sustainable model for health equity across Jordan. By applying the life cycle approach and the socio-ecological model, we create a foundation where every individual, regardless of their age or background, can access health resources and make informed decisions. Our youth advocates, economic empowerment initiatives, and digital tools together demonstrate that health is a shared responsibility and an achievable goal. Thank you so much.
Thank you, Mahmoud. That was a very informative sessions, and projects like Najahuna and Shababuna are really testaments to how programs that integrate the communities and the people that they are affecting can really make a powerful difference and move us forward in terms of health equity. And again, we reiterate the idea that community-based approaches are at the core of advancing health equity. We need to give people the power and the decisions to take charge of their health. And perhaps you brought on a few ideas when it comes to the models that RAS is following and its investment in raising awareness of the communities and perhaps investing in preventive health as well, which could be also an added value when we're trying to advance toward more equitable healthcare. And building on that, I'd like to go to our third speaker for today, Mr. Abdullah Nsour. Abdullah is the program manager for the Healthy Community Clinics here at RAS. Abdullah has over 14 years of experience in community health and leadership with focus on program management. Abdullah is going to give us a walkthrough on one of the projects at RAS as well that we're currently implementing that essentially addresses the different aspects related to providing NCD care in the humanitarian context, which we really said the inequities when it comes to health are really amplified. So Abdullah, the floor is yours.
Thank you, Sarah. Hello, everyone. This is Abdullah Nsour, the HCC, the Healthy Community Clinics Program Manager. Today, I will give you an overview of the INCDR project, the Integrated Non-Communicable Diseases Humanitarian Response that we are implementing since 2020. So this project is funded by the World Diabetes Foundation and also Novo Nordisk Foundation. So this project started since 2020 to tackle the challenge of having or delivering the health messages for the NCDs based on the facts that Jordan is a country of a 10 million population, that we're having a high number of NCDs, and where it is also accounts for 78% of national deaths. So also there is a stepwise survey where also it is mentioned that which is included also both refugees and host communities, reported that the prevalence of hypertension 22% of populations, and also diabetes 20% for population. So these came up with a rationale of having this project to tackle the problem or the challenge of having NCDs across a multi-stakeholder approach, and also multi-level with a trans-theoretical model of behavioral change, and also working with other stakeholders like the Ministry of Health. So next slide, please, Sarah. So this is the scope of our project: to reduce the burden from diabetes and host and other NCDs in Jordan for refugees and populations and vulnerable host communities, throughout integrating the NCD prevention and control in the humanitarian response in Jordan, and also improving the access to healthcare for diabetes and other NCDs. It is also mentioned that we are targeting through preventing the onset of diabetes and other NCD, with particular focus on the young generation. So in the right, you can see the HCC, which is the Healthy Community Clinics program, where it is coming to be cross-cutting, and it was also the cross program, the main program that is hosting this project. And then it is going to cross-cutting for all the projects that Royal Health Awareness Society are implementing. For example, the youth project and the community, were also having some activities with the community health volunteers to provide health education, and also referring to the health centers. The health schools also is providing these health education messages for NCDs for the school teachers and also school students. The advocacy efforts is going for multi layers, going from policy papers and also stakeholders engagement for decision makers, and also conducting some advocacy related activities, like hosting, for example, in 2022, we have hosted a national NCD conference. In 25, we are hosting also a regional conference between Jordan and Lebanon. Next, Sarah, please. So the project design was also focusing on some let's say key sustainable activities, having to giving the equitable access to everyone and everywhere. So what we have done is we have implemented through 193 plus Ministry of Health centers, having healthy community clinics, and also having the camps who are targeting the Syrian refugees with the 3 clinics in Zatari camp, and also another partner, Caritas Jordan, to have also within the urban areas in 10 clinics. So for the implementation research, we have also done a partnership with MFNet to have an implementation research, ongoing implementation research throughout the implementation of the program, to steer us and also give us some feedback from multi-layer of the stakeholders to direct and steer the project, and also design and being agile to design activities that are suitable for everyone who are targeted and affected by NCDs and being at risk or diagnosed by NCDs. The health information system as a sustainability objective, we have also have a partnership with electronic health solutions to have those are the exclusive health information system provider for the Jordanian Ministry of Health, to include the healthy community clinics within their system, so we can make sure that later on the Ministry of Health can manage the data and also have some insights and recommendations from the clinical indicators changes that happening with the people that are registered with the clinic. For the media advocacy, we, as I have said, the multiple activities going, like for example, we have obesity campaign that have all the social media posts targeting, for example, obesity and the health risk factors for NCDs, and also the consequences of having these uncontrollable diagnosed NCDs. For the health school as well, as I have mentioned before, that the schools also having the link. We have integrated, by the way, DM1 project also within the schools that are linked with our health centers to refer the patients who are diagnosed or at risk of the DM1 to be referred and to receive the service from the nearest health center. So this is like a nutshell. We have also like a network of 500 community outreach volunteers throughout the project life cycle. We have also have some more than 160 schools that were within the project, and also multitude of advocacy. The 6 partners that are working with us, the Jordanian Ministry of Health, Caritas, IFH, Institute of Family Health, Save the Children, Infinite, and Electronic Health Solutions. The evidence-based by conducting the parallel implementations research that are running throughout the project lifecycle, and also to develop a new data collection tool by the EHS Electronic Health Solutions and data monitoring tool, as I said, as a sustainability and ultimate goal. So this is the best lessons learned from our experience with this project, the multi-stakeholder approach that unify our and make efforts coordinated. This is already mentioned by Hamida and Mahmoud, that having more partners to tackle the challenge of NCDs that give us the power to have a bigger impact and also to achieve the best results. The strengthening the public system and avoid parallel system. This is also a very good lesson learned for us, that working with the Jordanian Ministry of Health to sustain our services and also to support the system, the ongoing system that is run by the Ministry of Health. It's better than having a parallel system or only going for the sake of the project. It's very good for our long-term planning with the Ministry of Health. So the life cycle approach as well, as Mahmoud explained before, it's also better for inclusion. Do not leave anyone behind. Targeting the NCDs, usually in the health centers, are going for the people who are already diagnosed above 40 years old. But we have thought about having the healthy school to target also adolescents, and going for other activities through community outreach, as well to target also the people who are in the young ages and universities and other outreach activities, and also through the camps to target also the refugees. So the behavior change for better outcomes, all our activities are linked with behavior change model, trans-theoretical model, going for the activity not only for providing the health education, but also following a behavior change model that ensure the people guarantee or maybe at least having the maximum impact and have praise for a positive health change for them. So this is everything from my side, Sarah.
Thank you, Abdullah. I think you presented quite admirably the efforts of the INCDR project that really offers a comprehensive approach, not only a multi-sectorial one when you're talking about tackling these issues on the fronts of education and health overall, but you also mentioned the multi-stakeholder approach, which is really important when we want to say mobilizing our efforts and increasing our reach in order to advance health equity on a national level. And that's very important because pooling our efforts together really helps advancing and ensuring the sustainability of our projects, and the accountability falls on multiple people, and it's not just one person that's driving these efforts forward. Also, you really showed us that these comprehensive efforts and health equity in general really needs to work starting from primary healthcare, secondary healthcare, and moving on to tertiary healthcare, because it's not just one spot in time where health equity can start to advance. It can happen even prior to reaching the need for health interventions, let's say. So thank you so much for your input on this matter, and to bring these concepts to life and to really showcase the efforts that have been done through the INCDR project. We'd like to share with you a brief testimonial video from some of our beneficiaries that we've been working with through this project.
نرجع على بلادنا، نشوف أمنا، أبونا، أخوتنا، قرايبنا، أرضنا، بيوتنا اللي تركناها.
أنا حاب يكون سلام ويكون محبة.
الإنسان على طول عايش في الأمان لكل شيء.
وأنا أملي بالله كبير إنه إن شاء الله تتحسن أمورنا لقدام، يعني على طول نظرتي للحياة إنه إن شاء الله بكرة أفضل من اليوم.
قمت اشتريت بسطة هيك وحطيت كام غرض عليها، وصارت هالأولاد تتعامل أنا وياهم. أنا مش ما فتحت البسطة وتعاملت في الشغل كنت 110 ونزلت ل 90 كيلو، لأنه بسبب إنه صار في حركة.
اثنين رفقاتي بنصحوني، بيقولوا لي لازم تمشي، لازم تخفف ملح بالأكل، لازم كذا. واتفقت أنا وياهم إنه كل يوم بعد صلاة الفجر إنه نطلع نمشي حوالي المخيم حوالي ساعة تقريبا.
كنت أسمع عن مرضى ضغط الدم إنه يحكوا إنه القاتل الصامت، فأنا أول لحظة يعني لما دريت نفسي إني مريضة توترت وزعلت وفكرت يعني إنه هون وقفت حياتي مثلا، إنه خلص صرت من المصابين بالمرض. أي شيء بتحتاج ملح على السفرة أنا لغيت الملح بالمرة من على مائدة الطعام عندي، يعني ما بنحط الملح بالمرة.
ويعني شوف الواحد يوم برتاح نفسيته بخف المرض عنه شوي.
احنا مع التوعية واحنا بنطالب بالتوعية، هذا المرض بده توعية.
So thank you all to our panelists. Really, you've given us the wholesome picture of the global perspective, the global strategies and frameworks that we were working on, how donors really view and want to promote health equity, and how that can go hand in hand with national efforts and the efforts that have been exemplified by the team here at RAS. I'd like to now open the floor for any questions or any insight from the attendants here. Please feel free to raise your hand or write your questions in the chats so that we can address them. So if we don't have any questions, I'd like to just jump ahead and ask some of our panelists a few questions. Starting off, Hamida, you really mentioned the role of partnerships in addressing these health inequalities. And perhaps you can give us some strategies that have proven to be very effective in overcoming some of the barriers that you've mentioned when it comes to, let's say, external funding and the implementation within specific kinds of communities, such as trust or cultural barriers. So what are some strategies you can give us in terms of those approaches?
Thank you, Sarah. I think investing in youth, we have been looking at the period poverty aspect in one of our programs called She Leads, and we have been working with the youth committee for the past 2 years, who's now doing excellent efforts on the ground, advocating on the period poverty, tackling such a sensitive topic with great confidence, reaching out to universities, to hospitals, to clinics, to even CBOs to talk about that topic, raising awareness, talking to adolescent girls, even now looking at the policy, related aspects that could be discussed on an advocacy level. So investments in youth is always successful. It's always a winning. It's a win-win, I think, game, and we have to put our utmost effort to invest in them deliberately, genuinely, and in each and every aspect of our work. That could be maybe one of the reflections that I could share.
Thank you, Hamida. I completely agree with you. And maybe building on that, since Mahmoud, you really focused on the role of youth and empowering youth. Could you perhaps tell us, from your experience working with youth, how do you maintain their participation and maintain their interest within the projects that you've worked on, since we've established that they have such an integral part in advancing health equity?
Thank you, Sarah, for this question. I believe, since I have also almost my whole experience was about youth development and participation in Jordan and in the region. I believe, as Hamida mentioned, investment in youth is instrumental for me personally. But I think what we should do, we work with young people is, of course, we should believe in them, but eventually we should have them like as leading individuals. So for them, they have to make their own decisions. They have to make informed decisions. Our part as organizations, regard national organization or international organization, is we pave the road and we make sure that they have an conducive and enabling environment for them to make better decisions. So for instance, for us, what we're trying to do with the young people, because we have youth is instrumental in every single project of RAS. But for us, what we're trying to do is trying to create a youth council that's for us, and this council is a body that has a lens from youth priorities and perspective. So whenever we have a program or a project, then the youth council has to provide some sort of like insight of their aspirations of this project or of this potential program, and we should make sure that their views are ensured, their voice are heard in the management decisions. So I believe believing in youth and provide them with the not only training, but we should they have some sort of mentorship programs, fellowship program as well, opportunities from where they stand, because sometimes the organization they forget sometimes to they have the custodian lens over young people, which I'm totally against as a youth advocate. So for us, we just pave the road for them and to provide them with an conducive environment where they can make their choices in a better way.
Yes, thank you so much, Mahmoud. I think we have one question in the chat, but we will need to respond very quickly because we're out of time, I believe, unfortunately, for the session. Linda asked, what roles have teachers in schools played? So Mahmoud, I believe you can answer.
This is for us. So RAS has worked with Ministry of, Ministry of Education is a key stakeholder for RAS. And we have two flagship programs that are basically, we work with Ministry of Education. So for us, we work on the infrastructure of the school and making sure that the schools are safe and healthy places for the students. But which is another second. The second layer is working with teachers and counselors. So for us, teachers and counselors are the key to reaching out to students and try to influence the behaviors of the students. So building the capacity of teachers, especially the health teachers, and as well as the counselors, because everything we do is related to mental health and counseling services at the school level. So for us, the teachers are part of manual development, like the manual development that we do at RAS. They're part of sometimes some of them are part of the technical committees of the projects, and basically they do deliver the messages to the students, not RAS, because eventually RAS believes in sustainability, and to make sure that these projects are sustainable is to be institutionalized within the ministry, with the relevant ministry. In this case, Ministry of Education is taking part of these programs. So the teachers and the councils are instrumental to our programs and the directions.
Yes. Thank you so much, Mahmoud, for that question. And I'd like to thank everyone that has joined us today in the session. Hopefully you will reflect on the models and the strategies that we've presented today, and hopefully implement them in your relevant context. So thank you so much. Thank you to our speakers who have really given us a very amazing perspective on the national level and the global level as well. So thank you so much.
Thank you, Sarah. Thank you, everyone.
Thank you.